Hi everyone, Billy McClean, Head of Community Health and Care Services here for the weekly vlog. I'm sorry I say a weekly vlog, it's been a couple of weeks since I last managed a vlog for a variety of reasons in terms of work pressures and annual leave. So today I really want to reflect on a couple of those pressures, in particular the unscheduled care pressures that continue across the system. This is a summer like no other I've experienced, and I know like no other that many of you will have experienced either. At the moment we probably have some of the highest numbers of delayed transfers of care we've had for a while, so we were up at over 70 delayed transfers of care in South Ayrshire at the start of the week, and certainly been on management calls throughout this week and last week because of the pressures on both acute hospitals, A&E departments, ambulance and our community services. So really challenging circumstances that we're all working under at the moment, and I know that's putting pressure on all of us. So just a thanks to everybody who continues to work to keep people safe across Ayrshire. Certainly my team have worked really hard this week to bring our delayed transfers of care down from 70 down to just over 50 this week, but that has meant that the number of people waiting out in our community for care at home, for instance, has gone up, with 90 people waiting for care at home out in the community. So really challenging circumstances that we're all working under, and of course that's happening across Scotland and the UK. We're not unique with that, but no end in sight at the moment for that. So just a big thanks to you all, and make sure that you're taking your rest when you can, because it is tiring. The other thing that is certainly putting me and my teams under additional pressure is that we are in the middle of our adult support and protection inspection. So hopefully you've all seen the briefings coming out. There's been a link to a survey. We really encourage all of you to complete that survey if you can. It's the more responses that we get to that survey across the system, and it's about the breadth of people. So I know some people who are watching this vlog work in the private sector and in the third sector. Really encourage you to complete the survey as well, because that gives us better information to help us improve more. So just encourage anyone who's received that link, and if you haven't received that link, please do get in touch and we can get that out to you. The other big piece of work that's going on around our adult support and protection inspection is the file reading, and that's putting a lot of pressure on, in particular at the moment, our social work team leaders. So again, just want to say thanks to all of our social work team leaders and social work teams who have been supporting that file collection this week, but over the next few weeks that file reading process. And a particular thanks to Sandra and Mark, who've coordinated that effort. I don't underestimate the amount of work that goes into that, and hopefully that will help us again get to the point where we have a successful inspection and we identify all those areas for improvement and areas that we want to celebrate. So thanks to all of you. Lastly, I just want to mention the team that I've been out visiting this week. So the district nursing team in Ayr, Jackie Danger and her team, met them yesterday. Really good to spend time with them, hearing some of the challenges facing district nursing, in particular in the Ayr team, but very common across the system. So some of those workforce challenges that I mentioned earlier, the pressures of increased demand for services, that's all making it very challenging for the team down there. But we were talking about the workforce review and how we can use that to improve the situation with district nursing across the system, and how we can look at, for instance, palliative care and join up some of those services across social work and care at home to deliver better services around the person. Also hearing some pretty frustrating information about accommodation, so how some of the basic accommodation needs are pretty poor for some staff. So again, just encourage you, if you are working in buildings where the wallpaper is falling off the wall, or in the district nurse's case, water coming in through the ceiling, please let us know. If we don't know about those things, we can't escalate those. So it was not great to hear about that, but we will get that sorted. And then lastly, on a much more positive note, I have had a thanks through for my vlog log this week. So the thanks came through from a service user's daughter who wanted to thank Rachel Muir in Mark Halpin's team, in the hospital social work team, for supporting her mum to get to Temple House, and just said what a fantastic job that Rachel had done working with the family to support her mum and support the family to make that a really good transfer despite all those pressures. Really nice to hear that individuals are getting good outcomes and experiencing a really good service. So thanks to Rachel for your efforts there. If you've got any questions or comments or thanks or anything else that you want including in the vlog, please do get in touch, and until next week, I'll speak to you then.